You guys ready? Good morning, and thank you all for being here. Today, we're here to announce the 2017 health insurance rates for Minnesota's individual and small group markets, and to give consumers in Minnesota important guidance this year on how to shop for insurance during the annual open enrollment period that begins on November 1st. I also will talk about the seriously troubling trends and developments that Minnesota is experiencing, like the rest of the country, in the individual health insurance market. I'm delivering an urgent call to action for critical and necessary reforms to protect Minnesota consumers who buy their own health insurance. First, let me take a moment to thank my staff who worked on what was an especially challenging year on the rate review process. Fred Anderson, Acting Deputy Commissioner for Insurance, Christy Bowen, our Chief Health Actuary, Lindsay McLaughlin, our Health Policy Advisor, David Sexton, Associate Actuary, Maybeth Moses, Health Project Coordinator, Candace Gergen, our Filing Analyst, Grace Fleming, the Health Law Attorney, and Laura Fink, our Actuarial Intern. They all worked very hard this year. I also want to thank the Department of Health for their staff and time on the work that they did with us in coordinating and collaborating on this year's rate review process. Over the past 4 months, we have put in many long and grueling hours. These folks are dedicated public servants, and I'm very grateful for their hard work in helping all Minnesotans with the work that they do. Joining me today is Allison O'Toole, the CEO of MNsure, and Dan Pollock, the Deputy Commissioner of the Minnesota Department of Health. So let me start first by giving an overview of and background of the rate review process. As the state agency that regulates insurance companies doing business in Minnesota, the Commerce Department is responsible for rate review. Our overriding goal is to have a competitive, stable insurance market that provides consumers with affordable, fair, and access to health insurance. It is important to recognize what rate review does and does not do. Rate review does not mean the Department of Commerce sets insurance rates. It also does not mean that we can force any insurer to do business in the individual market. With rate review, what we do is carefully evaluate the proposals submitted by insurance companies to ensure that they comply with state and federal laws, regulations, and actuarial standards. The department is sometimes in the unfortunate position of having to approve large rate increases proposed by insurers if they comply with the legal requirements set forth in Minnesota law. We are unable legally to disapprove rates that meet these standards. Let me assure you, though, we work very diligently to make sure that the rates are appropriate. Fundamentally, the proposed rates by insurers must be adequate to pay for expected medical claims and expenses on behalf of their policyholders. In addition to what we do at the Department of Commerce, the Minnesota Department of Health reviews and ensures that proposed plans comply with the requirements for adequacy of healthcare provider networks. Rates are determined separately by each market segment. Today's rate announcement is for the individual health insurance market and the small group marketplace, also known as the small business health insurance market. Each of these markets includes about 5% of Minnesotans, or approximately 250,000 each. So let me start with the 2017 small group market. Our small group health insurance market is stable. This market offers plans that provide coverage to businesses with 2 to 50 full-time employees. Again, for this year, we will have 10 insurance companies offering plans. The final average rates for 2017 range from a decrease of 1% to an increase of almost 18%, with the majority having increases in the single digits. The increases largely reflect the general rise in healthcare costs. Now, turning to the individual market. The tough news, of course, is in the individual market. As you can see from the information that has been handed out to you, the rate increase for 2017 are very high across the board. These rates do not affect most Minnesotans who are covered by employer-based insurance or public programs like Medicaid, Medicare, and Minnesota Care. However, these rate increases seriously impact Minnesotans who buy insurance for themselves and their families through MNsure, insurance agents, or directly from insurance companies. Minnesota's problems are part of a national trend in the individual health insurance market. Nearly all states are experiencing double-digit rate increases, and large insurers are quitting this market in many states. Insurers that are staying in the market are trying to align their premium revenues with their expected claims costs and deal with rising medical costs and the lack of federal reinsurance and risk corridor funding to stabilize rates. But Minnesota's individual market faces some unique challenges. Our individual market has a disproportionate concentration of people with serious medical conditions whose high claim costs must be absorbed by a relatively small pool of people in the individual marketplace. That pushes up rates for everyone in the individual market. As you know, in late June, Blue Cross announced that its ongoing financial losses in Minnesota's individual market were too great. The company decided to leave the market but kept its Blue Plus HMO affiliate. The company's decision affects approximately 103,000 Minnesotans, nearly 40% of the entire market. Let me say that we did everything we could at the time within our power to talk Blue Cross out of leaving the market. I personally met with the CEO and the chair of the board, but they were firm in their decision. Within days of the Blue Cross announcement, the other insurers indicated that they were prepared, reluctantly, to also leave the market. If that had happened, this market would have collapsed. For Minnesotans who needed to buy their own health insurance, we all were faced with the prospect that there would be nothing available. Nothing. In the weeks that followed, the Commerce Department pursued every option in its power to avert this collapse. We tirelessly worked together with the insurers to pull the market back from the brink with temporary solutions for this year. I held numerous emergency meetings with the insurance company CEOs, and my staff met regularly with the company staff to find a short-term temporary fix for this year. We worked day and night to save the individual market for 2017 so that Minnesotans who buy their own insurance would have access to coverage. We succeeded in saving the market for this year, but the result is not pretty. The rate increases are higher than anyone would like. The options will be more limited than anyone would like. However, there are options. When 2 to 3 months ago, it didn't look like we would have any options at all. Companies, however, would not participate in the market without rate increases and capacity limits to buffer significant projected losses on top of those already incurred. The rates that insurers are charging will increase significantly to address their expected costs and the loss of federal funding. In addition, as allowed under federal regulations, each insurer, except for Blue Plus, will limit its total 2017 enrollment. This is necessary in order for each company to manage its financial or network capacity to absorb the 103,000 Blue Cross enrollees, again, 40% of the market, who will be shopping for new options. In short, these are buffers to prevent financial or network distress. Some insurers have modified their service areas and networks. These changes will affect some consumers in greater Minnesota and the Twin Cities. So now, let me try to address Minnesota's options for 2017 and then going forward. Here's what Minnesotans need to know for 2017. Every Minnesotan who needs to buy their own insurance will be able to get insurance in the individual market. You will have access to a plan, but it may not necessarily be the specific insurer or provider network you would prefer, and it will almost certainly not be at the price that you would like. The annual open enrollment period begins on November 1st and continues through January 31st, 2017. I urge Minnesotans to shop early and compare insurance plans to find one that offers the best value for their health needs and your family budget. Let me pause and say, people who need continuity of care, meaning you need your particular doctor or healthcare system, you need to be especially careful this year to review the provider networks offered by the plans and to check to see what doctors, clinics, and hospitals are included. 7 insurers will remain in the individual market for 2017. At the start of open enrollment, every county will have at least 2 insurers with multiple plan options. Soon, insurers, agents, and MNsure will have specific plan information available for consumers. And in a moment, after I'm done, Allison will talk more about this for MNsure. But I strongly encourage Minnesotans to contact MNsure to see if they are eligible for federal tax credits that would automatically reduce their monthly premiums. While federal tax credits will help many make monthly premiums more affordable for them in Minnesota, these rising insurance rates are unsustainable and unfair. Middle-class Minnesotans in particular are being crushed by the heavy burden of shouldering these costs alone. Now, I think about these people across Minnesota. They are farmers, barbers, self-employed, retirees, child care providers, and others who are getting unfairly punched in the gut, who do not qualify for tax credits and go without assistance. These are hardworking men and women. It is imperative that we find solutions for them too. There is a clear and urgent need for reform to protect Minnesota consumers who purchase their own health insurance. Now, last year at this time, when rates were announced, I said there was a serious need for reform in Minnesota's individual health insurance marketplace. I proposed reforms then. Now the need for reform is even more critical and much, much more urgent. This past January, the Task Force on Healthcare Financing made important reform recommendations, but the legislature did not enact its recommendations. The sense of urgency apparently was not strong enough, or perhaps we didn't have the will to get it done. Well, now I hope people will see the flashing red lights and hearing the sirens, because this is a real emergency situation. If the individual market were a patient in critical condition, our efforts temporarily stabilized it for 2017. We can stop the bleeding. We can do something to bring the market back from this near-death experience and make it affordable for individuals. Now is the time to act. I proposed reforms last year. Every option must be on the table this year. Ultimately, consumers need rate relief, and the market needs stabilizing. Governor Dayton recently announced that he is reconvening the Task Force on Healthcare Financing to make recommendations to the legislature to ensure that Minnesota consumers have access to affordable, high-quality health insurance in the individual market. The reconvened task force must focus on the individual market's problems and any and all feasible options. Above all, it should offer recommendations that can be implemented in the next year that will strengthen the market and stabilize rates for 2018. This year in the rate review process, we received more than 50 public comments from Minnesotans. I read each and every one of them. They included some truly heartbreaking stories. Very hardworking Minnesota families are struggling under very tough conditions. They have painful choices under these skyrocketing costs. They are tough choices about whether to seek medical care and tough choices about whether they can even afford health insurance. Many of these people do not qualify for the federal tax credits that will help them reduce their premiums. It's simply this: their incomes are too high, not because they are rich. These are middle-class Minnesotans. They're getting squeezed, crushed by these health insurance costs. They say that health insurance, these people say that health insurance is unaffordable, and they're right. They are literally paying the price for a dysfunctional insurance market. Let me say this again, this is a very serious, urgent problem. It needs to be fixed, and it needs to be fixed now. Minnesota has always been a leader and innovator when it comes to health insurance, healthcare reform. Our challenge and opportunity now is to continue our leadership, our innovation, and reform the individual marketplace. I have and will continue to do everything I can to help fix it. I look forward to working with the task force, with the legislature, with the insurance companies, and with everyone to fix it and reform it in the coming years so that it doesn't happen again. I have and will do everything I can. The people of Minnesota deserve no less, and we need to do it urgently. So now let me turn it over to Allison, and then after that we'll open it up for questions.
Thank you, Commissioner Rothman, and good morning, everyone. I'm Allison O'Toole, MNsure CEO. Today's news about large health insurance premium increases is discouraging, for sure. But I want to make 2 points very clear to the people of Minnesota. First, MNsure is here to help you enroll into coverage. And second, MNsure can save you money. Only through MNsure can Minnesotans take advantage of cost-saving opportunities. These cost savings come in the form of an advanced premium tax credit. These tax credits act like instant discounts off premiums for consumers. An individual earning up to $47,520 a year, or a family of 4 earning up to $97,200 a year can qualify. We know right now that there are 100,000 Minnesotans out there who are not taking advantage of these tax credits right now and qualify because they haven't enrolled through MNsure. We don't want Minnesotans to leave money on the table. Currently, 2 out of 3 MNsure enrollees qualify for tax credits, saving an average of over $200 a month. However, as premiums rise, so does the value of tax credits for Minnesotans, meaning that in many cases, these tax credits can lessen or even eliminate these increases. So what does this mean for Minnesotans? Let me give you a few examples that are also included in your press materials today. A family of 4 in Rochester purchasing a gold level plan could see a rate increase from $1,505 a year or a month this year to $2,290 a month in 2017. that same family could also see their tax credit amount increase from $449 a month this year to $1,169 a month in 2017, meaning that family will only pay $38 a month more next year for the same coverage. A 25-year-old in Brainerd purchasing a bronze level plan could see a rate increase from $186 a month to $300 a month, but that same person would also see their tax credit increase from $63 a month to $193 a month, lowering out-of-pocket costs by almost $200 a month. That's real money for Minnesotans. We also know that enrolling in health insurance isn't always fun, and sometimes it's hard. That's why MNsure is here to help. We have more than 1,000 certified brokers and navigators across the state in every corner who stand ready to help consumers with this decision. These assisters will complete an application for consumers and present them with their options, all at no additional cost. Minnesotans anxious to start this process should go to our website, MNsure.org, to find assistance in their community and get an appointment scheduled. Lastly, I'll just say I know we're in the thick of campaign season. So today is going to be filled with political rhetoric from both sides of the aisle. I'm not here to play politics. I'm here to make sure Minnesotans have accurate information and know what to do and when. Political rhetoric causes confusion for consumers, and that is the last thing I want to do with something as important as healthcare for Minnesotans. Anyone who suggests that today's news is because of MNsure is playing pure politics and is frankly doing a disservice to the people of Minnesota. What's most important for consumers today is that MNsure is truly a solution for these increases, and we stand ready to help you. Thank you.
We'll answer questions.
Commissioner, can you explain why the Minnesota individual insurance pool is apparently sicker than other states?
So what's happening in Minnesota, and actually it's similar in many states, and in particular Minnesota, the best way to describe it is that we have a small number of very sick people with high claims and high costs for those claims relative to the size of the marketplace in Minnesota, which is smaller than other states and smaller than actually had been projected. So in essence, these people are paying, everyone in this market are paying higher costs because of those relatively small number of people. And again, that's why we need to take a look at some of the reforms to fix it.
Why are there more sick people in the Minnesota pool than in other states?
Or in the small business pool, the small group pool?
Well, first of all, I think in the small business pool, it's not experiencing the same situation as in the individual market. But back to your question, it's that Minnesota's higher risk people, relatively small number, have a relatively higher, significant amount of claims costs compared to the rest of that individual market. And our market is relatively smaller than the rest of the states. And the reason for that is because our economy is doing well, for example, and we have large and small group employers, or people getting insurance from their employers. We also in Minnesota have a good public program system. That includes the Medicaid expansion that we did. We have Medicare, and then also we have uniquely a terrific program in Minnesota Care. And all of these things are contributing to our relatively small risk pool in Minnesota. And again, so in order to address these issues, my perspective is that we need to look at those high claims, the high cost of health care First of all, we should tackle in any way we can address the high cost of health care. Some of the people who are high risk or high claims that are individual marketplace probably shouldn't be in this individual marketplace. They should be on Medicare or Medicaid. They may qualify. And there are the high costs of health care include the costs for specialty care. And as I said last year, there are same issues this year. There are high costs of specialty drugs that are driving up the cost of health care. In addition to the relatively small risk pool, these are contributing to what the difficulty is in pressuring the prices to go up. So let me also focus on another factor. In 2016, the federal funds for the reinsurance program, that was the federal dollars, will no longer exist for 2017. That's hundreds of millions of dollars not available to Minnesotans. In addition, the federal risk corridor program was defunded by Congress and did not properly fund the federal risk corridor program. The risk adjustment program is continuing to work and will into 2017. The federal government is tweaking that to make it to improve it. But because of the loss of the risk corridor program and the reinsurance program, those financial supports for Minnesota's marketplace went away. And that caused additional pressure on the rates to go up this year. So again, if you think about it that way, we need to tackle the high costs of claims, the health care, the underlying marketplace. I think we need to have transparency. We have to understand why those costs are happening and manage those costs. We also should tackle the real serious problems of the pharmaceutical industry that is gouging Minnesotans and all Americans. We also need to figure out a way to spread these high cost the cost of these individuals, not just to the individual market, but beyond. We used to have a system in Minnesota called MCHA, the Minnesota Comprehensive Health Association. That system took the high claims, the high costs of the individual marketplace and spread them beyond the individual market. It was spread to all of the health insurance marketplace. In effect, picking up the costs. And what's happening here in a nutshell is that without MCHA, without the financial supports, the only people who are supporting or shouldering the cost of the high claims in this area are those people that are in the individual marketplace. So we also need to look at expanding the pool. Last year I talked about, well, should we look at some of that? There's proposals to expand the pool. One proposal is to merge the markets between the individual and small group marketplace. And then, of course, I called for reinsurance last year, a backstop, financial backstop. That needs to be put on the table, discussed, funded, so that the financial supports can be put in place. And again, as I said in my remarks, all options need to be put on the table, looked at by the task force, and the best ones passed by the legislature this year to fix this serious problem.
Does that include starting MNsure, restarting it?
I would like to see that opportunity. The problem is that the federal government, the federal law, prohibits high-risk pools across the country. I had asked actually early on in 2013 to get an exemption for Minnesota so that we could continue our MCHA program for a time. The answer from the federal government was no, we could not do that. It also had a duplicative impact. There was the federal reinsurance program that was paying for the very same people. So it made sense at the time to wind it down, which we've done. But at the same time, I think it is an appropriate question to be asking and perhaps to seek federal authority, congressional approval for an exemption to have MCHA put back in place and have the assessments spread out the costs of the individual marketplace.
Commissioner, how do we go from, in 2014, touting the lowest rates in the nation and kind of putting forth Minnesota as a model of success and how to implement the ACA to the market being on the brink of collapse?
Well, the individual market in 2013 was, in essence, a new opportunity. Health insurers took the information that they had at the time, which was, as I said then, not a lot of information. They only had the information they had from prior experience individually. So the first year was everybody took a shot at it to the best that they could. And then, as you've seen, the insurance rates since 2013 have adjusted over time. And And again, I go back to the answers that I've given, which is that Minnesota has experienced a high number of high healthcare cost claims. It's a small number within the individual market pool, and that we have, compared to other states, a relatively small individual marketplace. And that is due in part because of the success we have in our commercial insurance market for employers, our public programs, the Minnesota Care Program, and again, the fact that the federal funding disappeared or is disappearing in the reinsurance program, and the risk corridor was defunded to a large extent by Congress. And without those financial supports, the marketplace is adjusting with higher rates and with the buffers that we put in place, particularly to address the decision by Blue Cross to exit the market.
But your department approves these rates that were submitted in 2013 and every year since then, so do you not shoulder some of the blame for the state of the market as it currently stands?
Every year, all the insurance companies submit the proposals that they want to sell their rates at. Every year, we look at those proposals to determine whether or not they're appropriate and reasonable, given the information that the insurance companies give us. And every year, as I said, those proposals looked actuarially reasonable. There was no reason that they wouldn't proceed forward. And every year, we've learned a little bit more based on the marketplace. And the market has changed every year. And because of that, all the insurance companies propose rates. And finally, most importantly, it's the insurance companies' decisions and at what price levels they wish to enter the marketplace and to sell the insurance. And that's where we look at it, and if it's reasonable, then under the law, that's what we look at.
In hindsight, do you believe that the rates were set too low initially in the Minnesota individual marketplace?
I believe it's impossible to look back in hindsight. The reason is that we had to look at what was and what existed at that time. There was a lot of uncertainty in the marketplace. There was a lot of unknowns. We didn't know, for example, what the insurance claims or costs would look like. We didn't know exactly how the federal funding would work, and over time, those supports have disappeared. So every year, things have changed, and the insurance companies have needed to address it. Every year, they've changed their proposals, and as we look at them every year, again, we approve them as necessary or not. We work with them to try to get to a reasonable amount. And at the end of the day, I think that, it's important for us to understand that, and let me focus again on this market, that because of the decision of Blue Cross to not stay in the marketplace, it created a situation where all the other insurance companies were choosing whether to stay in the marketplace or not. The Department of Commerce worked very hard under urgent circumstances to make sure that the insurance companies had a pathway forward and to make sure that we had a market in 2017. It's a temporary solution, and again, we need reforms to fix it going forward.
Is that
You
something?
mentioned enrollment capacity, something or another, capacity limits,
Yes.
which sounded like caps.
Yes.
Can you explain what those are?
Sure. Ross, can you grab that for a second? So under federal law and regulations, insurance companies, under federal law and regulations, insurance companies can ask for either financial or network capacity reasons to limit the amount of people or limit the number of enrollees they can accept that year. And so some of the companies, and we pass the information out and make that available, have proposed and we approved capacity limitations on the number of enrollees that they can or would accept this year, either for financial or network reasons. So for example, their provider networks could not withstand all 103,000 people marching over and going right to their insurance. So the idea is to put a buffer in place to prevent either for financial or provider network capacity reasons, a buffer in place to prevent distress.
Is the cap statewide, or does it vary by county? How, and for the consumer, does that create a situation where the consumer says, boy, I better buy on November 1st and get in under the cap if I want Medicaid or whatever?
The caps apply per company. So you take a look at each of the companies. There's one that does not have caps. So Blue Plus. And you have to look at each of the individual companies, and it applies across the state. But there are, for example, there are at least two companies in every county in Minnesota. There are 3 in many, in the majority, or 4. And so the answer is absolutely yes. People need to Minnesotans who are buying individual insurance, need to look at their own insurance, look at the companies that they have, shop early, and make sure that they have the option to either renew, stay with their company, or if they want to choose a different company, move to a different company as soon as they can.
And what are the caps for the different companies?
We have that information, so we'll provide it to you.
Is it possible that 2 insurance companies in a county may hit a cap? So somebody who lives in that county can't get insurance in December or something?
It's overall, as I said, every individual in Minnesota will have an opportunity to buy insurance. I believe that the caps are set at a reasonably high enough for, say, right at the right place for everybody in Minnesota to have an option. So whether an insurance company hits their enrollment cap and a particular individual wanted to choose from them, going back to Chris's point, people need to shop early so that they can get the choice that they want.
Is there any contingency for someone that might find that they don't have a choice because they waited too late?
Well, a good example of that would be for individuals who want to keep or renew their own insurance. There are some who are getting notices, for example, from Blue Cross who have to switch. But for those that, other than Blue Cross, have the option to renew, those people will have the option to renew regardless of any capacity limitation.
If they want the tax credits, they have to go through MNsure.
And if you want the tax credits, the only way to get the tax credits are through MNsure. So again, I encourage, and there's 100,000 people that are eligible that are not getting tax credits even today. Everybody should shop, go to MNsure as soon as the information is available and during open enrollment. Check to see if you can get a tax credit to bring the cost down, and then shop for the best plan. And again, I mentioned this before. To me, there's also a situation where if you need that particular doctor for your particular medical condition and you want to keep them, you need to check to see if if the plan that you had will be offered, and if not, how you might be able to solve your continuity of care problem.
And this may be a health department question since they've studied uninsured, but anybody can answer it. I've got people telling me that they can't afford the $24,000 or whatever a year for insurance for the family. So it sounds like if their insurance is going to increase, they may just not have insurance, risk federal law and everything. Is this a concern? Are you folks expecting the uninsured rate to increase now because of the increases in premiums?
Minnesota's uninsured rate has been trending exceptionally well. We've cut it in half from about 9% to in the 4s, okay? I think what with Minnesota, and the reason why we have such a great number is because of all of the healthcare options and reforms that Minnesota has made. It's important to also understand that approximately half of the people in the individual market, again, it was 250,000 people in total, approximately half or more qualify for tax credits to reduce that cost. The other half will not have, or have to basically shoulder the cost themselves. So yes, there will be individuals in that situation. You know, for some, they should look at whether or not, obviously, it's an individual situation. They have to look at their own health care. Some people can't go without the insurance. It's a question of suitability for themselves. I encourage everybody to do it as much as possible. And going forward, we'll keep a close eye. We're going to, the Department of Commerce and my colleagues will keep a very close eye on the issues that you're raising. And again, this is another reason why we need to have reform, another reason why we need to fix the marketplace. We need to make sure that those who can't afford it have an option, either through, we bring a price mechanism in place to solve it, we figure out a way to spread the cost to a greater number of people so that they can afford it going forward. Chris?
Let's see, the map that lists the number of insurers per county actively marketed, is that on or off the exchange?
Which page are you on?
Page 14.
I believe if we're looking at the same map, it's on the exchange. It's hard for me to know though what your exact, there's one that, there's a number that says right at the top, number of carriers per county on the exchange. There's another map that has per county actively marketed. And then so one is specifically to the exchange and the other is to the broader market.
I don't see that.
Yeah.
Thanks.
Yeah.
You talked about how the small group market has been relatively stable. For perspective, can you tell us how the large market has been doing?
Well, actually, the large group market is not regulated by the Department of Commerce. So we don't keep any of that data or information for me to comment.
The small group market stability is interesting because, I mean, you commented that one reason the individual market is doing poorly is because it's a relatively small group of people. So a small number of high-cost claims can have a huge impact. But the small group market is the same size and yet doesn't appear to have these same high costs. Do you have any information as to why the population there is so much healthier?
Well, that's the case, that the small group market does not have a small proportion of people in the pool that are very high-cost claims in comparison to what's happening in the individual marketplace. So for that reason, it's more stable. The insurance companies have much more information about the small group market. There's more certain information, and those rates have tended to be more stable because of it.
There was reference to lowest elimination a couple of years ago. I mean, when you look at small group rates, is it a process of the individual market catching up with small group, or are individual market premiums above and beyond what folks in groups are paying?
We have data and information that shows that the rising rates of the individual market and compared to the rates of the small group market have converged. They're approximately the same, and the trajectory of the individual market rates is increasing at a higher rate than the small group marketplace. So the convergence happened, last year and this year, and there will be, if these trends continue and we don't fix or solve the individual marketplace, that trend will continue where the individual market rates will be higher than the small group market rates.
Is it possible, though, that they've hit the mark they need to be at? Like,
It is possible, but it's also something that needs to be determined going forward. But at the same time, that doesn't address the unaffordability problem and the crunch and the crush that families and individuals are facing even at these rates. And that's a problem that needs to get fixed.
For MNsure, You've had a few years to get the word out about tax credits and things like that. You still have a lot of people who aren't taking advantage of it. What are you going to be doing different from here on to get that word out?
Thanks, Don. Well, we're going to be working tirelessly in the next 6 weeks and through open enrollment to make sure that word gets out. We have a robust marketing campaign. We are communicating directly with those Blue Cross members who have, the ones that we know about, who have lost their coverage. And I'm going to be traveling the state, frankly, and working, day and night to make sure everyone knows. We're also working, we talked earlier, Don, about, I went to Farm Fest this summer and heard from a lot of farmers directly that they are Blue Cross enrollees and they have anxiety about this. So we're going to be working with the farming community, through the Farmers Union, and through other partnerships around the state to make sure we get this word out.
On most of those who are not getting tax credits, do you think they would get a substantial amount of credits to really lower the bill? Or are we talking about a few bucks here or there?
No, I mean, there are examples in the packet, Don, that show, these tax credits are real money for Minnesotans, and it is, the smartest thing to do right now is to make sure people shop and compare and figure out if they can qualify for a tax credit. The examples I gave earlier show significant decreases, and we've seen many examples where the tax credit can lessen or completely eliminate that increase. So it's really, it pays to shop. The other thing I want to mention too, Don, the other thing we're doing, we have, that army of assisters across the state ready to help everyone with these decisions. We've had a record number of brokers, new brokers certify with us in the last few weeks too. So that group is amping up, and there are truly people ready to help in every corner of the state.
If there's no significant change, reform like you're calling for in the next year, are you going to be standing in front of us a year from now saying we have no individual insurance policies?
Well, the way I look at it is that I said it last year, so that's once. I'm here a second time. And I think that everyone, again, as I said, need to hear the sirens and the red lights. We're in an emergency situation. Reform is absolutely necessary. We have some proposals. Everybody who has suggestions should propose those. They should go to the task force and the legislature and get those fixed so that we're not here next year.
But if there are not major reforms like you suggest, will the companies offer insurance next year?
Now, I can't speak for the companies. I won't. What I think is important, though, is that we need to address these market problems so that we're not here next year with the same situation. Any others? All right. Thank you, guys. Thank you, everybody.
Time for lunch?
Yep.
On you?